Everybody can get MGD. Even children can get MGD. Like I said, the biggest culprit is, just our decrease in blink rate. And so a lot of us are spending time. So my youngest daughter, who is 11, has MGD, and I've scanned her glands and everything. But makeup, poor makeup habits. So it's not the makeup. The makeup is not the bad thing in most cases. Check ingredients. We'll talk about that later. But it's usually the person who's using it, right? So they usually poor application. So they're putting their makeup in places they're not necessarily supposed to go. So some popular terms are putting liner on your waterline. So that means you actually physically put a liner right on the kind of the wet part of the gland, and then they call it a wet part of the lid, or a tight lining, where they put liner on the upper lid, and those will all your glands leave. And then not properly removing your makeup, right? And so either not taking it off at all, or just using like a makeup wipe and not going behind and really cleansing, getting that debris off of there, and then resetting the normal load of bacteria. What I usually say, we have normal flora. So there's certain washes and wipes and things that you can use to help reduce the chance of that happening. And just not just mainly it's just the makeup, the applicator, not the makeup itself. Now, there are some makeups that have really poor ingredients. I tell patients that a lot of the cosmetic industry is not regulated, and a lot of those regulations have not been updated since the 1930s. So there are apps and things out there now that you can scan the product, get a better idea of the ingredients that's in that product, and it'll kind of flag and say, red, green, or yellow, like this is not good. You may want to find an alternative. And there's a lot of other makeup lines that are more vegan, more organic, natural, and there are even some lines that are formulated by actual eye care professionals themselves. So they make sure that those ingredients are going to be safer. There's no complete way, preservatives and things, you need those things in your makeup, right? But there's ways that you can minimize some of those things that are going to cause some issue to the ocular surface. So makeup, I wear makeup. I don't want to give it a bad rap. It's just that you have to be able to make sure you take it off and know what you're putting around your eye.